If your students are participating in class, come into class prepared, fully engaged in the discussions that we're having during class time, and they're also passing exams, but yet when they get to simulation, they really struggle with those hands on experiences. Well, that's what we're talking about today. You're not alone, and we're going to explore how does storytelling, how do those hands-on experience truly translate to competency? And it may be more than what you think it's about. Welcome back, everybody, to Dr. Sellars Educate. Our mission is to support all nurse educator colleagues on their journey to achieve certification. If you're a nurse leader, if you're a nurse showing up here as well, we're excited to welcome you also. Now, when we think about competency, there are many different components associated with this work. And I say work because competency is about achieving that higher level of mastery. We've been taught that engagement equals learning, and we know that's not necessarily true. Our exams, when students pass them, tell us that students have or should be able to have a level of cognitive learning, at least mid-level, to where they are able to go deeper in those comprehension of concepts. But this is what can often happen. Students come to class, they engage with us in a conversation because that's essentially what learning is all about. We have discussions in person, or we may have discussion boards. We even have polls. We may use Kahoot, we may use Poll Everywhere, and yet our students are struggling. This is what we know. The problem is competency. They may have that surface learning that we talk about and not be able to draw from prior experiences associated with scaffolding, looking at how do students truly build on their prior knowledge in a way that allows them to transfer information, to transfer that knowledge that they have validated through the exams that we give, and be able to actually apply it in the classroom. All right, so what else are we talking about during our time together? We know that competency is not built through exposure, it's actually built through experiences. So knowing that there is a component of engagement that can equal learning. However, we have to explore that deep comprehension of concepts. What would we mean by that? Clinical judgment. Have they truly been able to apply the skills that we have explored in the classroom, or have they engaged in enough of that surface learning to where they can actually memorize answers, right? They haven't quite gone deep enough. So yes, engagement can equal learning. It's just about the depth of learning that our students have been able to achieve. Competency is built through iterations. It is built through experiences. We want to be able to give students formative feedback because that's what simulation experiences should be, right? They are demonstrating a skill, and then we debrief about those skills that they have demonstrated or maybe not, right? There's a coaching opportunity for us to have with our students. And then this is what else I want you to think about. All right, so let's talk about a scenario. It's time to apply. And then we're going to look at a thought-provoking question, which you all know that we always like to do. But when you talk about application, here's what it looks like in practice. All right, so I want you to take a note of this. If you haven't already, every time you show up with us, we want you to pull out your study worksheet. That study worksheet is listed right here in the description. This is going to allow you to stay focused during our snapshot time. That's what we call these series, okay? We're going to also talk about how you can go deeper. All right, we are spending, just like it says, a snapshot of time, so a small amount of time to explore, at least introduce a concept, and then we want you to go deeper at the end of our time together through your debrief, taking notes. All right, so on your study worksheet, you should have written down number one, what is your objective? Okay, now that you know our topic, you know what we're exploring today, what is your one takeaway that you want to be able to achieve at the end of our time together? We want to decrease your cognitive overload. And our way of doing that is by not piling on too many concepts in our snapshots. Okay, so you're focusing on truly competency and how to ensure and validate that your students are able to engage in the clinical judgment skills that we know are so important. All right, so now let's apply. All right, so listen to this scenario, and I want you to write down a note about it, and then we'll take a look at our thought-provoking question, and you'll write down that too. So this is what it looks like in practice. A student can explain sepsis perfectly on the exam, and maybe even in the discussions that we're having with students, they can really walk through those cues that they're able to recognize: abnormal lab work, abnormal assessment components, maybe change in the patient's mental cognition. So when we talk through students about the sepsis diagnoses and unfolding events, they can articulate it pretty good. But this is what happens: a student gets in simulation and they freeze while the patient deteriorates. They can articulate to us what cues they're recognizing. They can't even identify abnormal vital signs, right? That's a problem. So, in order for students to be able to transfer those skills that they've been able to validate in the classroom through the exams, right? Because we talked about them passing exams. We want to engage in connection with our students. How can we connect? Storytelling, discussing lived experiences that we have had as faculty, and leveraging students, encouraging them to share their lived experiences as well. Students know the facts, but they've never practiced thinking through the story, thinking through what's going on in a person's body when they're experiencing sepsis. Hopefully, early signs of sepsis, right? Not those late signs. Clinical judgment, this is what we know about it. Clinical judgment is not about recalling information. It is truly about a student's ability to articulate what's wrong, what's going on, and what they're going to do about it, what they recommend to the provider to help this patient not continue to decline, right? That's what we want. We want students to be able to recognize that something's not quite right, and this is what I mean by that. These are the signs that indicate to me that something is not right with this patient. Our students' ability to stay engaged, and we talked about this in a previous spring series session in 2026. So it is 2026 right now. I know it's hard to believe. You want to think about, as a nurse educator, the different climate that we're in 2026 as it relates to the competing priorities that students have in their lives. Regardless of which type of nursing program it is, it can be accelerated, it can be traditional. We know that there are many competing priorities for our students. Many of our students work, they have families, they have lives outside of learning. So how can we truly help them engage on this learning journey actively, right? So that they are able to not only build confidence, but build competence. And this is what else we know when it comes to the ability for students to truly learn, that it's about Bloom's alignment, right? So we think about the bottom level of the cognitive learning domain. Go with me to Billings and Halstead, Teaching and Nursing, the 6th edition. You're going to find this information on page 188. Okay, so 188 through 190 is all about the 3 learning domains in Bloom's alignment. Okay, so to decrease your cognitive overload, we're just going to focus on what 2 questions you need to ask yourself as it relates to Bloom's alignment. Oftentimes we ask ourselves, did I cover it, right? So thinking about that lowest level of Bloom's taxonomy for the cognitive learning domain, which is remembering. We want students to be able to build on that. That's what Bloom's is all about. So how did I, as a competent educator, how did I align these important Bloom's concepts with the actual hands-on learning experiences that students have had? So it shouldn't be only a question about whether or not I covered it in class. We want to go deeper, right? Just like Patricia Benner tells us to. We want to ask the second question of, did they practice using it, right? So first question is, did I cover it in class? Did I connect? Did I align my conversations that I'm having with my students? Because that's all teaching is, right? That's all facilitation of learning is. It really is about a conversation, or at least it should be. We don't want to be that sage on the stage. We want to be the guide on the side with our students, going along on this journey with them to ensure that we're not leaving them behind, that we're able to bring them along on this journey that allows them to close their knowledge gaps and have that deep comprehension of concept. So yes, question number 1 is, how did I align with Bloom's taxonomy not just at that lower or mid-level domain, right? I want to be at that application, I want to be at that analysis level. And ultimately, the highest form or highest achievement of the cognitive learning domain is going to be at that creating level. Okay, that's the highest form of cognitive learning, is at the creating level. So, did they practice using it? In order to go deeper and have a full comprehension of explanation of this concept, you want to take a look at Snapshot 241. Okay, that's right here listed in the description as well. This is a huge faculty blind spot that we've seen with so many nurse educator colleagues. Teaching versus learning. That's exactly what the Snapshot 241 explores. What does it look like for us to have that deep comprehension of concepts that allows us as educators, first of all, to have a full understanding, and then second of all, that allows us to be able to transfer that knowledge and really facilitate that learning with our students. Okay, so our final point, as you're writing down some key concepts that you're exploring, including, again, going back to Snapshot 241, okay, to make sure you have identified your muddy point related to these concepts and gone a little bit deeper than during this snapshot. So let's take a look at this thought-provoking question. We want you to write down what you think, and then we're going to look at the correct answer and the rationale. Senior nursing students earn high exam scores, yet demonstrate inconsistent clinical judgment during simulation. Faculty describe the course as rigorous, but students depend on checklists and frequently seek validation before making clinical decisions. Which faculty strategy best preserves academic rigor while strengthening clinical judgment and self-directed learning? We have A, redesign learning activities so students must defend clinical decisions using evidence during structured debriefing. B, increase the complexity of simulation scenarios while maintaining detailed procedural guidance. Or C, expand assessment strategies to include more NCLEX-style questions that emphasize application. All right, so I'm going to give you all 10 seconds to write down not only the correct option, but I also want you to write down the rationale for the choice that you are making and why you believe the other two choices are not correct. All right, so 5 more seconds. And then we'll take a look together, and that will be the end of our time together. All right, so let's take a look and see what you think. If you chose A, give yourself a round of applause. A is the correct option because it requires students not only to evaluate, but also to justify and to reflect on their clinical decisions. It's not enough for students to know the what. We also want them to know the why. Okay, that's the really important part of reflective practice. It directly targets higher levels of blooms and supporting the development of independent clinical judgment. Options B and C, they do increase task or assessment difficulty, but students are able to continue to rely on external structures such as validation, verbal validation, or testing rather than cultivating learners' reasoning and metacognitive skills. That's what we want. That just means deeper learning. We want students to have this deeper learning experience as we explore the concepts that we go over with them. So how did you do? We want you to take some time to pause, to reflect, and then to act. You're taking some time to pause, to think about what was it that was a muddy point for you. If you didn't choose A, or if your rationale perhaps didn't match, taking some moments to really reflect on what are your knowledge gaps. As you're moving forward on this journey to achieve CNE or any other certification, it's still relevant no matter what certification journey you're on. Taking the time to pause, taking the time to really process the information that we have explored during our time together is going to help you have a deeper understanding of these concepts. We had a colleague that just asked us this past week, what makes your program different? I think it's an excellent question and one that we enjoy having a conversation about. And the number one reason why our program is different is that we are about taking each nurse educator on this journey side by side to help you become better, to help you achieve excellence, to help you advance your competencies in a way that allows you to be a more effective educator and to help your students provide safer patient care. The reality is we never know when we're going to be in the bed, right? In a hospital bed, or our loved ones. And so our ability to give back and to impact the next generation is a really important part of the mission that Dr. Sellars Educate has in place. So pause, reflect, and act is what we want you to think about. We at Dr. Sellars Educate believe that each of you can achieve success. So take a minute to think about, what is your number, okay, based on our conversation today. Did you have a lot of muddy points? So is it a 1 you felt lost in our content review for today? Or do you feel like you're ready to teach, right? You got it. It's a thumbs up. You knew exactly what we were discussing today. You know exactly where your gaps are as it relates to competency 1 and 2. That was the majority of our alignment with our content today. If you still have muddy points, make sure you reach out to us. We don't want you to struggle alone. DrSellarseducate.com is where you can find all of our resources to support you. And you can send us an email at any time, info@drsellarseducate.com. The only way you want to achieve success is if you quit. We know that many of you are on a journey to achieve CNE or another certification, and we look forward to supporting you as you move forward. And we also look forward to seeing you next time. Remember, if you need to go deeper, and we encourage for you to do that, check out Snapshot 241. We'll see you next time. Have a great one, everybody.